case of 74-year-old smoker presented with blood-stained cough. Regarding differential diagnosis, make a quick list of possible causes of a given presenting complaint, and ask questions to rule in, or rule out, the possible differentials, as in this case, bronchial carcinoma, pulmonary embolus, pneumonia, pulmonary oedema, are the top differentials in our list. Here, we are discussing relevant questions to take a brief history, keeping ourselves structured within a given time frame. Now, we ask detailed questions using the mnemonics ODPARA. Onset. How did it start? Did it come on suddenly, or gradually? Duration. For how long is it present? Progression. Since the start of symptoms, is it getting better or worse or staying the same? Is it the first time, or were there previous episodes? Aggravating factor. Have you noticed what makes it worse? Relieving factor. Have you noticed what makes it better? Associated symptoms. Cough, chronicity, mucus color in blood, breathlessness, chest pain, weight loss, bone pain and tiredness, abdominal pain, for liver metastases or hypercalcemia, headache, for brain metastasis, smoking history, occupation, for exposure to industrial chemicals, coal dust. Ask for any risk factors for DVT or pulmonary embolism, past medical history of ischemic heart disease and congestive cardiac failure, constitutional symptoms, like fever and productive cough. At this point, we have ruled out possible differentials and make our approach align towards a definitive diagnosis. To support it, we can perform a quick physical examination and lab investigations. As in this case, we can check peripheral stigmata of bronchial carcinoma, including cachexia, nail clubbing and tar-stained fingers, for smoking, tattoos from previous radiotherapy, respiratory examination, including cervical lymphadenopathy, tracheal deviation, for lobar collapse, dull percussion node, for consolidation and diffusion, reduced air entry or bronchial breathing. Check for signs of metastases, any, hepatomegaly, spinal tenderness on percussion with heel of hand, focal neurology, suggestive of cerebral involvement. Now it's the time to tell the patient about the management part, including investigations and treatment. Regarding investigations, we have options of chest X-ray, for any mass, pleural effusion, and bone erosion, CT chest, bronchoscopy, CT guided biopsy, or lymph biopsy. Regarding treatment, we have plan of surgery, or lobectomy. Medical options include chemotherapy, cisplatin gemcitabine, radiotherapy, palliative care. Meanwhile, address the concerns of the patient. In the end, it's the time to close the case and talk to the examiner.